All right. Hi, everyone. Everyone can see my screen okay? Thumbs
Yes.
up, everybody? Okay, perfect. Thank you all for bearing with us. This was definitely a last minute shift, so forgive me if the presentation is not perfect, but we're gonna push through. All right. My name is Dr. Ladrea Williams-Briggs. I am the executive director and founder of #NotUsSC, and this is improving maternal health outcomes through patient-provider communication and education, equipping patients, engaging communities, and strengthening communication. There we go. Okay. So I want to preface this with saying that I do not work for the state health department. So for more, I'm not the expert on this data. So for more information on this data, please reach out to Kim Jenkins, who is on the South Carolina Maternal Mortality and Morbidity Review Committee and can provide you a more in-depth look at this data. But on March 1st of this year, the South Carolina Maternal Mortality and Morbidity Review Committee released its 2026 legislative brief. Just a few highlights from that data. This includes data from 2022 and 2023. We saw an overall decline in the maternal mortality rate, but persistent racial and geographical disparities. Specifically for non-Hispanic Black women, the pregnancy-related mortality rate for that group was 2 times that of non-Hispanic white women. And in rural counties, we saw the pregnancy-related mortality rate was 94% higher than in urban counties. All right. Also, we saw a change in the timing of deaths from this year's legislative brief than last year's. We saw an increase in the deaths that occurred the day of delivery, with hemorrhage as the leading cause of death, and we saw a decrease in deaths that occur in the first 6 weeks postpartum. The primary cause of those deaths was infection or hypertensive disorders. I also want to highlight that in this legislative brief, we learned that 88.2% of maternal deaths in 2023 were preventable. And we also saw disparities in the leading cause of death between non-Hispanic Black and non-Hispanic white women. We see here that for non-Hispanic Black women, the leading cause of pregnancy-related death was cardiomyopathy. And for non-Hispanic white women, it was mental health conditions and substance use disorders. I also want to highlight a really awesome tool that exists if you guys want to do more of a deep dive into this data. The Empower Maternal Health Interactive Data Dashboard is now active. It does allow you to break data down into the county level. And you can look at really cool things like preventable C-section rates, maternal health support networks, and all kinds of cool things. So check that out when you get a chance. All right. So, out of this legislative brief, we also got a few key recommendations. One, all providers and hospitals should extensively provide education to postpartum and pregnant women and their families about the maternal health warning signs. So, what does that mean? Let's first talk about health literacy. Health literacy is the foundation for effective patient education. It's an individual's ability to obtain, understand, and act on health information. In August of 2020, the CDC actually changed the definition of health literacy to be a little more robust. The new definitions emphasize people's ability to use health information rather than just understanding it. They focus on the ability to make well-informed decisions rather than appropriate ones. The new definitions acknowledge that organizations have a responsibility to address health literacy, and they incorporate a public health perspective. So, a couple things we know about health literacy. One, we know that low health literacy leads to delays in care. There have been a few studies that have found that women with low health literacy are more likely to delay or miss care. And increased health literacy equips and empowers people to better understand their options, to seek out medical care or community-based support, and to make informed decisions. So, the more health literacy skills that someone possesses, the better off they are. All right, so patient education. Effective patient education helps patients recognize urgent symptoms early. It begins early in pregnancy and extends well into the postpartum period. It enables clear symptom description to providers and support networks. It encourages timely action and follow-up care, reduces preventable complications and disparities, supports home and community decision making, and it helps expectant parents make sense of all the available information and feel secure in their healthcare decisions. A lot of the studies that we see it seems as though sometimes providers are speaking one language and patients are speaking another. So when providing patient education, it's important to ensure that the message is communicated, but also received and understood. Lastly, effective patient education empowers patients and reaffirms that they are the experts in their own bodies and have an active role in their care and well-being. All right. So, there have been a few studies that have investigated barriers to effective communication, specifically for healthcare providers and for their patients. For providers, we saw a lack of physical space or dedicated space to provide education. Of course, work overload and time constraints, having a lot of patients to see, having to get through several visits in one day, understaffing, poor health education materials, language barriers, not just spoken language, but body language, a difference in cultural understanding, authority and whose role it is to educate patients, and then some providers having negative attitudes about the role of patient education. Then for patients, we saw that they experienced a lack of focus on the woman's individual needs. Some patients felt that health education that was provided was superficial. Also, overcrowding and the amount of time that's given for patient education, lack of facilities and space, medical jargon that's difficult to understand, and then staff attitudes and feelings about patient education. All right, so couple tips and tricks, evidence-based teaching tools that can elevate patient education. The teach back method, it's one of my favorites. This method promotes patient engagement, patient safety, adherence, and quality. It ensures that you've explained medical information clearly so that patients and their families can understand. And it asks patients and supporters to explain in their own words what they need to know. So essentially providing the patient the education and then asking them to tell you what they've learned in their own words. Plain language works for both written and verbal communication. It's using simple language and explaining any technical terms, using an active voice, breaking complex information into short segments that are easier to understand, providing the most important information first, and then focusing on the most important concepts. Instead of throwing a bunch of information at one time, instead choosing the top 2 to 3 key points that we want to deliver to patients. And then active listening. Active listening means giving your full attention, validating feelings, and confirming understanding to build trust, reduce anxiety, and improve adherence to treatment plans. So reflecting and paraphrasing, summarizing the conversation, acknowledging the patient emotions. I see you're upset right now. Do you want to talk more about that? Using open-ended questions. These are all ways that we can communicate to patients that we're listening, and that we understand what they're saying to us, and that we're here to help. A few more key points on elevating patient education, engaging support networks. Support persons often notice changes first. They help reinforce education after the visit, and they can support decision making in urgent moments, improving adherence patient care plans. Also, support networks help extend communication beyond the patient. We only see patients in that snapshot of that moment. What happens when they go home? Using visuals and demonstrations, most patients won't remember everything you say, but they may remember what they can hold, see, or walk through. Visuals and demonstrations turn information into something that patients can recognize later, that they can explain to someone else, and that they can actually use when it matters. And lastly, something I think a lot of people forget about is creating supportive office environments. Every interaction matters, and every interaction can build or break patient trust. Remember that the patient experience starts long before they enter that exam room. Front desk, schedulers, staffers, all help to shape impressions. And negative interactions can discourage care seeking. Consistent, respectful communication builds patient trust, which increases engagement, which increases follow-up and openness, which increase patient outcomes. All right, so let's look beyond the clinic. Again, most decisions happen at home. Patients are in that building for a good 30 minutes, and then they spend the rest of their lives out in the community, in their employers, in their work offices. Meeting patients where they are can strengthen understanding and trust. Trusted environments like faith-based organizations, self-care or beauty salons, places where patients frequent and trust reinforce learning. Community settings normalize conversations about symptoms and care, especially around mental health. And support networks can gain language and confidence to support mothers in the most urgent situations. All right. Another thing that I often hear as a patient educator is a lack of continued support. So, making sure that we're linking patients to maternal support programs and community-based resources. These could be things like hotlines. The National Maternal Mental Health Hotline is awesome, and local community contacts, community-based programs. Home visiting programs are a wonderful way to extend that patient care beyond that office. Having someone to actually go into their home to see how their social environment impacts their health and to address factors that may negatively impact health outcomes. Peer mentorship programs, digital support networks like different Facebook groups. Postpartum Support International also has some really great digital support programs. Connecting patients with social services that can address social determinants of health, like food, transportation, and housing, connecting patients with mental health services, and then collaborating with doulas and community health workers. These are the people that eat, work, and live in the communities where your patients are from. Seeing them as gatekeepers and as people that can really break into the community and relay patient education is a great step into ensuring effective education. But let's remember that education is only a step. Patients need ongoing support and connections. Education is only a piece of the maternal health puzzle. As we all know and recognize, there are several other systemic and organizational factors that impact maternal health outcomes, but education is one piece of that. All right, so now we're going to do an activity. Are we okay to do my activity, Rachel? We're good? Okay. Okay, cool. So
Wait, wait, wait,
if,
wait. Sorry, if we are doing an interactive activity, I need to stop filming.
yes, please.
Okay. So I thought that was gonna be for the second part, but we're gonna jump into that now?
Yeah, we're moving a little early.
Okay, no problem. So, folks, we're doing things a little bit differently today, and this is for people who are going to watch the recording later. We only record the didactic slides and the presenter speaking because we want to create a safe environment for all of our live participants. So we never film when participants are chatting or unmuting or sharing. So I'm going to stop recording now.